Hello everyone, I'm Dr. Sumit Mitra. I'm consultant hematologist and hemato-oncologist at AMRI Hospital, Salt Lake, Kolkata. 15th September is Lymphoma Awareness Day. So what is lymphoma? Basically it is cancer of the lymphoid tissue. Such lymphoid tissue is scattered all over the body. It is present in the neck, in the armpits, in the groin, within the throat, in the abdominal cavity in an organ called the spleen. So these are sites where lymphoid tissue is present. And in case of lymphoma, the symptoms are swelling of these lymphoid glands. The swelling may be small, of a small marble size, or it may be larger, that of a ping pong ball or a golf ball. In some patients, the spleen is enlarged only. There is no lymphoid tissue enlargement. So they complain of a swelling in the abdomen or a lump in the abdomen. And in addition, there are other symptoms like there's significant weight loss, drenching night sweat, or a low-grade continuous fever. In some patients, there may be other symptoms like intestinal obstruction, because such lymphoid tissue is also present within the stomach and the intestines. So when we see a patient with symptoms of lymphoma, we ask for a tissue diagnosis. Here the surgeon helps us mostly. They take out the enlarged gland and send it for biopsy. In some patients, the node may be deep within the abdomen, or say only the spleen is enlarged. So in such cases, what we do is we prefer to do a bone marrow biopsy and see whether the cancer is infiltrating the bone marrow or not. Now after we have spotted lymphoma within that affected tissue, what we do is we do a test called immunohistochemistry. This is a very important test because not all lymphomas are alike. Some are T cell type, some are B cell type, some are low-grade indolent, and some are aggressive. So we need a tissue diagnosis beforehand with a particular type of the lymphoma, because there is no therapy which is common for all. So by the test of immunohistochemistry, we know the exact type of lymphoma and we can get an idea about the behavior of the lymphoma. After this information, we seek further knowledge about the spread, what we call the stage of the lymphoma. For this staging, we do a particular test called the PET-CT scan. This helps us to know how far the cancer has spread within the body. Now after having all this information regarding the lymphoma subtype, the idea about the lymphoma behavior, how far it has spread, we start therapy. Now a good thing about some lymphomas is that, notably follicular lymphoma, is that we don't need therapy as soon as the disease is diagnosed, because such lymphomas are very slow growing and there are adverse effects of the anti-cancer drugs, so we prefer to wait. There are multiple modalities of treatment. We have chemotherapy, we have immunotherapy, for example drugs like rituximab, we have radiotherapy, and oftentimes we combine these three modalities. There are new drugs which are coming up, notably oral medications like ibrutinib. This is useful because it helps us to bypass hospital admissions and painful injections. Now with low-grade lymphomas, with modern therapy, the survival is very good, more than 80%, and the patient nearly has a normal quality of life. Even with higher grade lymphomas, there are new drugs that are coming up, newer protocols that are being devised, which will help to make the outcome better. And the future is not at all grim in this lymphoma subtype. Thank you everyone.